Let's start with how a mask might help. So most importantly, you might actually have the coronavirus and not even know it, in which case wearing a mask will actually protect other people from catching it from you by blocking your infected droplets coming out of your mouth and nose. The mask might also protect you from other people's droplets, and it might also prevent you from touching your mouth and nose with your hands, which could easily have become contaminated by touching any infected surface. But there are pitfalls. So the mask doesn't cover your eyes, where the coronavirus can also get in, and a lot of people don't use these masks properly. So the whole idea is that if the mask is blocking those infected droplets, then the coronavirus is sitting on the surface of the mask. So you've got to wash your hands before you put it on, you've got to wash your hands after you take it off, and you never touch the surface, which means doing things like this defeats the purpose. So what's the right type of mask? So this is an N95 mask. It's designed to block microparticles created during certain medical procedures. It's meant to be airtight, which means it has to be fitted to each person's face. It gets hot and sweaty, it can leave bruises. So if you're not a healthcare worker, you really shouldn't be wearing this kind of mask. This is a surgical mask. So this is designed to block those droplets, and that's exactly what we want. This is a bandana. So this and other types of cloth masks will probably reduce transmission of your own droplets to others, but they're not designed to block other people's droplets. So if you use them, you still have to try to maintain that physical distance. So what should you do? Well, if you're sick, stay home and wear a mask to protect others around you. If you're not sick, I would say it depends. Ideally, don't leave your house, in which case you won't need a mask. If you do leave your house, try to stay 6 feet away from anyone else, in which case you also don't need a mask. But if you can't do either of those things, I think wearing a mask properly will reduce the chances of coronavirus transmission. So if you've got a medical grade mask, you can use it. If you don't have a mask and you want to get one, buy a cloth mask. But either way, you've got to use the mask properly, which means don't assume you're invincible. Don't stop washing your hands, don't stop trying to physically distance, and always handle the mask as if it's contaminated with the coronavirus. Finally, don't forget that hospitals are running low on masks right now. So if you've got a supply of unused medical masks, ask your doctor how you can get those back into the healthcare system, because your providers desperately need them right now.